So, hi there, secular fam. I hope that you are all enjoying this beautiful Friday and are cruising into the weekend with joy and hope at the forefront of your activities. Speaking of activities, check out your local indivisible AZ groups to see what they've got going on this weekend. I just got word of a pretty exciting action that's taking place on the west side in Maricopa County. So, if you are interested in getting Adelita Grijalva into her rightful office, and so that the people down there actually have representation, you'll want to click that link so you can participate in that action with the rest of us. The number of local threats to our First Amendment rights are becoming too many to count. Last night in Peoria at the Unified School District Board meeting, there was a first reading of two policies that will severely limit the First Amendment rights of students, families, and staff in the district. One policy would eliminate much, if not all, out of district professional development and all performing arts partnerships and memberships in the district. And another would essentially designate any non-MAGA staff member as an enemy of the district. Does any of this sound familiar? She's essentially modeling herself after 47, and she's doing it at a smaller scale in the Peoria Unified School District. So we really need some help over there. They also blame Democrats from the dais for the government shutdown. So they're also politicking at the dais. And in Fountain Hills, Arizona, the town council will be considering the erection of a Charlie Kirk statue. So if you're interested in speaking out, you'll want to fill out our volunteer form, and we can give you the tools to speak out against Christian nationalism in your own backyard. But for today, we are speaking with three guests about the Prop 409 ballot initiative. We are going to be talking with three local superstars about 409 that would expand services, modernize facilities, and help train medical professionals at the county's only public teaching hospital, Valleywise Health. This medical center provides care for some of our most vulnerable neighbors. So we have three panelists today, and they have such extensive resumes. I am actually going to let them introduce themselves and talk about why this bill is so important. So we are going to start off with the lovely and talented Dawn Penich. And Dawn is with Agave Strategy. So I'm going to let her talk a little bit about the work that she does and the folks at Agave do. Hi, Dawn.
Oh, great. Thank you. Good to see you all again. I think last time I was speaking with you was probably last cycle when we were working to pass Proposition 139, which was Arizona for Abortion Access. And of course, that was a huge win that protected access to that important medical option for people all across Arizona in our Constitution. So I'm delighted to be working this fall on another measure that ensures and expands our access to healthcare, especially with all of the attacks on healthcare at the federal level and all the confusion and uncertainty there. This is something that we can do here locally. This is a Maricopa County specific measure, but those of you tuning in from other areas of Arizona, as I've been talking about this, I've gotten a lot of folks saying like, I don't get to vote that one on my ballot, but this is good information that I'm now going to bring to my county supervisors, to our leaders, and see what we're doing for similar services and access in our areas. Let me go ahead and share my screen. And because we do have someone even more knowledgeable than me about Valleywise also on, I'm gonna keep it quick for through a number of these slides. So for Maricopa County voters, this is what's in your ballot right now. If you haven't returned that ballot yet, you have until Tuesday to mail it back. And then after Tuesday, you're going to want to hand deliver it to a voting location. Or you can actually, if you didn't get a ballot, that's actually something that I've been hearing more than I was anticipating. Folks who didn't get a ballot yet. You can also go to a voting location to in-person vote a replacement ballot right there on the spot if that's needed. So definitely don't let a voter roll or a county recorder mistake keep you from voicing your values in this election. So this is what I'm going to go through quickly because I know that Lia Christiansen can tackle it much better. But as Jeannie said, this is our only public teaching hospital in the county. They specialize in emergency and level 1 trauma. They have the burn center, and one of our largest providers of behavioral health care, mental health care. This bond will allow Valleywise to expand. And so there are already facilities, clinics, hospitals spread across Maricopa County, but we have already outgrown anticipated demand. And so what this is allowing us to do is actually build to catch up with the demand that we already have, and then make sure that we have that as our county continues to grow, which all signs are that it's going to continue to grow and we're going to need this additional support. These are some of the details that, again, I'm going to race through because you'll get better information here in a second, of the types of specific expansions that this bond will help finance. So this is where we get into the math, and this matters to everybody because, you know, things are expensive out there. So it's a little bit wonky, but boil it down, it's 11 cents per $100 of net assessed limited property value. So this is not the cost of your home on Zillow. This is not even the cost of your home when, you know, the county assessor sends back the much tinier number that has your assessed limited property value. And so you can see in the corner a home that Zillow is saying is almost $600,000. The figure that 11 cents is being pulled out of is that bottom figure of 25,000, massively smaller number. So for that home, Prop 409 is asking for just $28 a year. And so, you know, I'm on Nextdoor and all the socials and kind of hearing the haters talk about no more money. This is too much money. This is the kind of money we're actually talking about to be able to ensure and expand our safety net healthcare system that is helping thousands and thousands and thousands of people access healthcare, which is always going to be cheaper than when we find ourselves in a crisis situation. So that's what we're talking about, less than a cup of gas station coffee once a month.
I seriously feel like that needs to just be like that little piece that you said right there needs to be clipped into a short video and played on absolutely every social media like outlet on the planet, because that is such an important distinction. So thank you for that.
Great, thank you. I know, and actually this is, if you go to the website, yes, on 409.com, there's an actual calculator that is, it's pulling data from the actual county assessor's site. So you can, if you're a homeowner, you can find your exact parcel, and then you can calculate exactly what your Prop 409 contribution is going to be. I did this. It's super fun to be able to find your own home and get the exact number. So if you want to know for your house, you can find that on, yes, on 409.com. So one thing that I like to highlight is, you know, for folks on our end of the spectrum, these are some of the endorsements, many more than what you see listed on this screen, of our state leaders, municipal leaders who know how invaluable these facilities are. You'll also see on here the Medical Association, the Nurses Association, the firefighters. My favorite story here is that my father-in-law is a retired paramedic who worked in Phoenix for his entire career. And then when he retired as a paramedic, went on to be a paramedic instructor in the community college system. And his story is that, you know, back when they were working, he and his colleagues would write on their undershirts, "If I'm hurt, take me to," and in his era, they called it county, right? Before it got its proper name, right? So he would write, you know, first responders want to go to Valleywise for their care because that's how excellent it is. And that is the kind of teaching that therefore is happening when we talk about Valleywise is our public teaching hospital. That means that even if we aren't going there for our own care, the doctors and nurses who are training at Valleywise go on to work all over this state. And it's such large numbers that I think, like, statistically, for sure, we have been taken care of by someone who got their experiential training at a Valleywise location. And so that just kind of speaks to the impact, the ripple effect of why we need to be able to keep this kind of quality care. I also want to mention something that I think is incredibly rare and quite refreshing these days, which is that the Republican side of the House, in terms of endorsement and support, is just as impressive as what we see on the Democratic delegation. So Prop 409, in addition to this Democratic support, is endorsed by former Governor Doug Ducey, former Governor Jan Brewer, County Attorney Rachel Mitchell, County Sheriff Jerry Sheridan.
Wow.
So this is a truly bipartisan priority. And we don't get to see that much in this day and age. So I always mention that because it's so unusual. But that just speaks to this would be, and that's why the doctors and nurses associations are in such strong support as well. This is way too big of a chunk of the pie, the overall healthcare pie in our state, to not invest in it, to not help and grow it to meet demand. So I'm going to wrap up here. I'll take questions if I can answer them, but more importantly, I want to get to our other wonderful speakers. But if you have any questions, if you're in Maricopa County and you haven't gotten that ballot yet, or you don't know where your voting location is, just Google it, Google Maricopa County Recorder, and those links will pop right up for you.
I have one question about this, and it is, oh shoot, I had it and then I lost it.
You sound like me.
I swear, menopause has been very unkind to me. If I get back to it, I will let you know. But
Sounds good.
and I'm not seeing any questions. You did answer the question about the fact that there are Republicans who are supporting this, so that is fantastic. If I get back to that question, I will. But for now, since there's nothing in the chat, let's go ahead and go to Lia Christiansen. So Lia, if you want to go ahead and introduce yourself and let us know a little bit more, we're all ears. And make sure you unmute.
Thank you so much. Yes. I'm having demolition right out of my window, so I'll mute when I wasn't talking because there's some loud bangs. So Lia Christiansen, I am the Chief Administrative Officer for Valleywise Health. I've been here about 4.5 years. I have about 30 years in healthcare, coming from 2 systems in Minnesota prior to coming to Valleywise. And I've just been so proud to work on the strategy to get us to Prop 409. So the evaluation of our needs, both from an infrastructure standpoint and what our community needs for care based on the growing population that we're experiencing in Maricopa County. So I too have a little deck that I will share. And let me just put it in presentation mode so it's easier for folks to see. All right, are we set? Do you see slides from me up? Okay, great. So still, we have found that people don't necessarily know and understand the brand of Valleywise Health. So I like to just say we were Maricopa Integrated Healthcare System, or the county healthcare system. And many folks still know us as that way. And when I'm out and about, tell me they were born at county. We rebranded ourselves in 2019 just to help kind of segment ourselves off a little bit from the county perception, because we're a health system for all, although we serve Maricopa County. You can see our history as we started as a pest house, so long time service to patients that had tuberculosis and other diseases, where we jumped in and cared for folks, and that long history of serving the underserved and the sick continue. We were the first medical residency program, and I'll talk more about our service and education and medical education in a bit. We're the nationally verified burn center. We're the second biggest burn center in the US and the biggest in the Southwest. And, just invite you to learn more about our burn center. It's actually the 60th anniversary some celebrations around that happening right now. So you'll see some of that on our social media and our stories. And in fact, we did a documentary a couple of years ago of some of our past burn patients who climbed Mount Kilimanjaro, which you can find streaming on some of the local services now. And that's so inspirational. So we're a level 1 trauma center. So that means the catastrophic car accidents, burn, gunshot, those kinds of things come to Valleywise. And again, we're a public teaching system and a safety net system of care. This is just where we serve throughout the community. A little key here, but I wanted to showcase that, we have a large presence here at 24th and Roosevelt, where our main acute care hospital is, but we have a footprint of our primary care around the metro. So we have 3 behavioral health centers. So those are hospitals, one in Maryvale, one in Mesa, and one here on the downtown campus. We have 11 community health centers. So those are clinics in the local community. And we have 2 emergency departments, the level 1 trauma here on this campus. And then we have one in Maryvale as well. It's actually an ED in our behavioral health hospital. And the reason that we have that is when we bought that hospital from another system and converted into behavioral health, there was still a great need in the community for emergency care. So we kept an emergency presence there in Maryvale as well. Just a little visual to show you how diverse we are and spread out across Maricopa County. A lot of those who might travel, there's some hubs around our clinics, as you can see, but then beyond that, that burn care brings people from all over, as well as the need for behavioral health. Just some numbers for you. We have 644 licensed beds. Of those, 411 are behavioral health beds on those 3 campuses I referenced. We have 6,000 inpatient behavioral health admissions annually. 3,500 folks receive outpatient behavioral health services. That could be for our seriously mental ill folks in a clinic. And then we have what's called a first episode clinic for young people who are experiencing mental health challenges for the first time. Kind of an intensive program where we're found that we're able to really help and stabilize the people who come to us there. And then emergency visits, we have about 111,000 annually. And then the ambulatory visits are the clinics that we have. So just trying to give you kind of a feel for the numbers of how many people we touch annually. Here's just a view of the burn admissions, because this is such highly specialized care. I wanted to show you how much of that we care for in the local community and why burn is such an important program of ours. We do research. We have a cohort program where we have all the services on one floor now. So if you're an inpatient, you come back as an outpatient. We have other people who have experienced burns being here on campus with you to be a coach, a cheerleader, and you can get through this traumatic time kind of experience. I want to talk about medical education. So we are part of the Arizona Health Education Alliance. So you can see there, we partner with Creighton University, Dignity Health, and our district medical group, which is a physician group in town. So through us, we came together to say, let's work together to make sure that we're getting medical residents, physicians, and it's expanded out of pharmacy, nursing, PT, OT students, but particularly focusing on the medical education. And the reason for that is we had a traditional background of teaching medical students and residents, but here in Arizona, we have a gap of primary care. So people who can see you first in the clinic environment, and then also there are gaps in other specialty services. Not unique to Arizona, but critical for us. So our goal through this partnership is to really continue to grow physicians that will stay in Arizona. And I believe the statistic is just over 50% of the people that we train, we are able to keep them in our systems or here in the Valley at least to continue their practice. So often when I'm in the community talking to people, that's what resonates with people. They know the challenges of getting in with their primary care physician or the delays sometimes because there's just not enough doctors for all the care that we have. So to be able to really partner to expand care is important for us. We did, and this is a question I get too, like, why is Prop 409 important? You've just opened a new hospital. And so that work was done and planned in 2014. And yes, in the last year, we did just open this beautiful hospital you see on your screen. But that was planning that was done in the past, and the current ask is to help us grow into the future. Maricopa County has really expanded and grown since the pandemic and beyond, and the needs that we see continue, and we've outpaced some of our planned growth, and thus need to come back to the voters to ask for support. The demolition is happening right now on this building behind me. So right now, what will happen is there's parking plan for this space. If Prop 409 were to be supported by the voters and pass, this is where our new behavioral health hospital and outpatient services will be built. I referenced the behavioral center in Maryville that has the ED. I just wanted to show you that. And then these are our clinics that we updated and worked on with our last bond, which was our planning from 2014. So that's kind of the past and who we are. And so we were doing a planning process to say, what do we need to do to help support the local community? And so what's next for Valleywise Health? So we needed a 10-year plan to take us into the future and support the healthcare needs here. So through that assessment, we came up with some recommendations, which we know that behavioral health needs continue to grow. We provide all the court-ordered evaluations here for the county. In our 3 hospitals, we do have courtrooms to help our patients go through that process. We do about 500 court-ordered evaluations every month. And as you probably well know, just for being community members, the need for behavioral health right now is beyond what there often is for beds and services. So we want to expand an additional 100 inpatient beds and really make that environment a great teaching space for our learners, making sure that we have skills development built into those areas, healing environments, and again, create more capacity for the community. On the primary care side, we focused on where are some of the older clinics that need to be rebuilt and expanded. So this is just a map of some of our areas. This South Central clinic, we'd like to find land nearby and expand. This is a clinic where our family medicine and internal medicine learners are to care for patients on a primary care environment. And then, of course, they come into the hospital to do further learning. So that's one area. The Chandler Clinic here is another one, and we're just looking for some expansion in the central area to capture all the patients who are still need more primary care. From an inpatient standpoint, you heard some about this from Dawn. When we opened the new hospital, we, in the planning in 2014, thought that we would shell the 10th floor, thinking that, hey, more stuff's moving to outpatient care versus inpatient. And that just hasn't been the case for us. We have been full since the day we opened in June 2024. I think for the patients that we see most of our inpatients are coming in through our ED. About 81% of our patients come in through our ED, which is different from a community hospital model where they're more planned admits from a physician in the community. So we've had this high census, and we've also had a very, very busy ED. So we're asking through this prop to complete our 10th floor of the hospital, which had been shelled, to add additional observation beds. So people who are in the ED waiting for a little bit longer care or into the inpatient environment can move to an observation bed so we can improve the flow of our ED patients. And then we have higher volumes for our labor and delivery moms. So to kind of remodel a little bit to accommodate more laboring moms and peds for the hospital. So you heard a bit about this already. So we're asking for this $898 million from Prop 409 to build a 200-bed behavioral health hospital, build out the 10th floor, enhance our physician training, expand services in the build a new outpatient specialty healthcare center here and replace 2 of our community health centers. We talked about the tax value. I think Dawn covered that very well. I use examples of that too. And I'm getting, of course, a lot of questions from the local community who have questions about, what's the value, and a lot of it's confusion over this. So I agree with what you were saying. Like if there's, ways that we can continue to tell the story here in the next week about what the personal impact is for people, that's a valuable exercise for us. And important too is that renters have no financial impact. I think, they see some of these chatter on Nextdoor and they're not paying that property tax, but they believe that impacts them. So that is my presentation. So I'm also happy to answer any questions.
I remembered my question. So I'm curious too, because this is a teaching hospital. And again, thanks to Agave Strategies last year, right, we now have better protections for abortion access than a lot of other states do. And I remember, hearing after the decision about Dobbs, that states where they did have way more limited protections for abortion healthcare, people were fleeing, medical students were leaving the state. So I'm curious if because we have codified that, if we now have med students who are choosing to come to Arizona, and specifically if Valleywise has seen an increase in that.
There are med students who really want to choose Valleywise for their care, and it's primarily on the trauma services and the burn services, because the acuity of what we see and provide here are like no other, or like only other tertiary kinds of care. We have some land restrictions that we have related to an abortion question. So that isn't a service that we do on the campus. We use our other medical partners to do that teaching for students. So I think the residents that you referenced in your question wouldn't choose us because of that.
I see. Okay, that's another really important distinction too.
Yes.
So are you saying that the old building, the one that was behind the newer building in
Yes.
the picture, that one's going to be demolished?
It's like 50% down right now.
Oh, it is. And the reason why I actually, back in the day, like in a different lifetime, it feels like I took like a 6-week course there for certified breastfeeding counseling.
Okay. Yeah.
So if anybody ever needs help,
Okay. I always say if anybody has kiddos, like bring them around the campus, because it's such fun for kids to watch this demolition. Like, we have very low productivity probably in our offices right now because we're watching out the window. It's such a fun experience. So.
I was going to say, it's not just an activity that kids would find compelling to watch. Here's a great question in the chat from Jennifer. And she says, are the facilities LGBTQ friendly?
Yes, absolutely. And I might highlight as well our McDowell Clinic. That's a specialty clinic that we developed, brought from the county when it was originally started. And when we were spun off into a special healthcare district, we continued that. So it's an HIV/AIDS clinic with other services and care in that clinic, but that is the primary focus. And of course, has done that work since 1989. So highly supportive, engaged, leading in clinical care for our patients there.
Yeah. When I reflect on 1989, it wasn't necessarily the most open-minded time, although 2025 is really not, faring well either. So
that's right. It was a little ahead of its time for the county in 1989. But if, just like any other clinical service, if you bring the interested and most expert providers together, then those patients get great care and clinical outcomes. So it's a very safe and place for patients.
So how, with the big bill and all that stuff and the projected increases in folks' healthcare, how do you see that affecting, the various campuses that you have to provide healthcare to people in Maricopa County? If folks, I mean, I pay a lot in health insurance, and thinking about it, even 50% increase is very worrisome for me. So thinking about 150% increase is what some of the estimates are saying. How will that affect you?
So a lot of our patient population is Medicaid, which we call access here in Arizona, and then Medicare self-pay, and then other commercial insurance. So if you look at the bill that you're referencing, there are changes and cuts coming and proposals related particularly to Medicaid, and then also some of the matching dollars that facilities such as ours receive. So of course, we're good stewards of the resources we have. We're looking out, mapping out when those take effect and if they would take effect. So there's a lobbying strategy still to help tell the story of what an impact could be, but also then operational strategy to, what does that mean for us? And so we're doing that work now. I think it's important to know that because we serve the underserved, the capital to do the investments that we're talking about for 409, we don't have the operating capital to do that. So we can run our day-to-day operations, care for our patients through the funding mechanisms that we have. But unlike other nonprofit or for-profit hospitals, we don't generate enough margin to create the capital to do projects such as we're proposing in 409. So to add this, 200-bed behavioral health hospital that gives us another 100 inpatient behavioral health beds is only possible through going to the voters and asking for support. So I think sometimes that's not understood as well either by the voters, is that, well, why don't you just pay for it out of your own capital? We just can't.
Yeah. Well, and it's so like next door is the worst place to have those kinds of conversations. But I would say that, just perhaps even mentioning that there's a whole list of Republicans that support it could help folks in that regard. I mean, it's silly that that's,
Yeah.
what it would take, but in some cases that is what it would take. So I'm looking here and I don't think I see any questions coming in for you, Lia. So thank you so much for, all the information that you provided today. And thank you for the work that you do every single day to provide for our most vulnerable communities. We appreciate you.
Thank you so much for inviting us on. We appreciate the chance to tell the story and, help answer any questions. So I appreciate it.
Right on. Well, with that, let's go ahead and turn it on over to Lindsay Love. I know Lindsay from years ago when we both served on separate school boards together, and boy, oh boy, not a lot has changed, right, Lindsay? It's such a bummer.
The only thing that has changed is that I am not sitting on the dais. We're not sitting on the dais, so.
No, and you know what? I, follow all of your social media and stuff like that, and you just seem a heck of a lot happier. And I'm really glad that you are fully leaning into the very important work that you do. So feel free to go ahead and tell everybody about that work.
Yeah, sure. Let me just make sure that I'm sharing it. I feel like I've now become a part of the auntie generation, and so I feel like technology for me is becoming a struggle. I'm getting like my mom, where I don't know how to use like remotes and stuff. So, but my name is Lindsay Love, and as Jeannie shared, I did serve on the Chandler Unified School District Governing Board for a full term for 4 years. In that process, I've always been a clinical social worker in the time that people have known me. And I've been a licensed clinical social worker for over 10 years at this point. But during that time, while I was on the school board, I opened up my behavioral health practice, Therapy Love. I went from working in the community behavioral health side, now for Valleywise. I was at Jewish Family and Children's Service as a clinical manager. And then last year, myself and one of my therapy colleagues, we decided to open up a nonprofit called Girlfriend Culture, where we create curated rest and retreat spaces for Black women, which I think was especially near and dear to my heart, I will say, because I was that high achieving Black woman who was facing harassment both at work and while I was on the dais, right? And that does impact your physical and mental health. But as I'm about to share here in this presentation, um, Black women are not able to find help even when we are in the process of asking for it. And so LaShonda and I both work with Black women in our behavioral health practices. And girlfriend culture was also a calling from them in terms of we need to build community spaces here in Arizona for Black women that focus on belonging, healing, sisterhood, and justice for Black women, because we have been excluded from traditional healing models. But I want to begin by inviting us to think about what mental health really means, not just as a policy term or a service to fund, but as the everyday reality of people in our communities. For many Black women, mental health doesn't start in a clinic or a counselor's office. It starts in community. It starts in the spaces where we can finally exhale, where we're safe to take off the armor, rest, and be seen. And that was the vision behind girlfriend culture, creating that space for rest and healing for Black women who've carried far too much for far too long. But care can't stand alone. It has to be supported by systems that make healthcare accessible, responsive, and rooted in equity. And that's why local investment measures like Prop 409 matter. They're about more than buildings, even though, like, we do need that building capacity, as Leah shared, right, to serve more people and more beds. But they're also about capacity and expanding behavioral health services so people don't wait months for therapy, and even expanding that pool of primary care physicians. We have so many people, Black women in particular, who are new to the Valley, and the wait times for a primary care physician are insane. And not being able to find a primary care physician that really meets their needs, right? Um, Increasing like inpatient and emergency room beds so that those in crisis get the help instead of handcuffs, right? Because we know that a lot of our behavioral health needs in the Black community, the folks who come out to help are not your EMTs. People call the police on us, and police do harm or kill us in the midst of those things. But girlfriend culture was about rebuilding community care centers, right? Our community care, so that we could center that in the absence of enough available community care, like services. When we expand mental health access, we also address the physical realities that too often shorten Black women's lives. Stress-related hypertension, heart disease, autoimmune disorders, and chronic fatigue that come from living in a world that rarely offers rest and support. And what we're really talking about is a full ecosystem of care, community spaces like girlfriend culture that nourish the spirit, and public investments like Prop 409 that strengthen the structures around us. And together, they move us from surviving to thriving and building a future where wellness is a privilege, isn't a privilege, I should say, and it's a right. The numbers around mental health care are sobering. So, according to the Highland Project's 2025 political survey, nearly half of Black women voters said their mental health has worsened over the past year. Many link this directly to economic stress, caregiving responsibilities, and the constant weight of racial inequity. Yet these same women remain some of the most civically engaged voters in the country. We organize, we lead, we vote, we show up, even when we are exhausted and even when we feel unseen. And then the Exhale State of Self-Care for Black Women report gives us a deeper insight into why this matters. 77% of Black women said there are not enough culturally relevant mental health resources available to them. 66% identified racism and discrimination as major barriers to accessing care. And I can't tell you how many clients I've talked to where I've not been their first therapist, but their journey throughout the mental health care system has been plagued by trauma. Therapists who have microaggressed them, denied their experiences, and we're not really culturally humble. And 72% said they would be more likely to use mental health resources if those resources actually reflected their lived experiences as Black women. And these findings tell a story many of us already know, that while we carry our families, our communities, and our movements, there are very few spaces designed to carry us. Traditional mental health systems often weren't built with us in mind. They pathologize our strength instead of understanding it. They misread our exhaustion as resilience. And they fail to recognize that the strong Black woman trope often leaves us isolated and overburdened. They don't hear our pain. And that's where girlfriend culture really comes in. My business partner, LaShonda, and I, here we are in black and white so you can see, created girlfriend culture, like I said earlier, because we were called to. And I think that many Black women in activist spaces will tell you that they didn't get involved because they necessarily wanted to get involved. It was incumbent upon them to get involved to ensure their survival and the survival of their communities, right? And that was the same call that LaShonda and I had when we created girlfriend culture. We were called to make a space for alternative methods of healing that reflected who we are as people, as Black women. We created a curated retreat experience centering rest and sisterhood for Black women. Our first event was a Galentine's Day party that we held at the Culture Hub, which was a Black co-working or Black-owned co-working space. And we just told them to date us, right? To get to know each other beyond what we do for a living. And then our largest event was at the Desert Botanical Gardens, where we centered Black women in nature and called in our ancestors, getting back to the healing ways that our ancestors used before colonialism robbed us of that. Now, we both have our own practices. Like I said, mine is therapy love, and LaShonda's is abundance. But LaShonda and I are just two therapists. And as ambitious as we had to accept something hard. We couldn't serve everyone. But what broke us open was what we kept hearing from our clients. Black women who were exhausted, not just from life, but from systems that constantly failed to see them. And so many weren't coming to us as their first therapist. They came after harm. They told us about clinicians who called themselves allies, but denied their experiences, minimized the impact of racism, played devil's advocate as if the devil needed any advocates, instead of standing beside them in their truth. And we listened and we realized the truth. The mental health system was never built with our pain in mind. So we decided to step outside of it. And that's the work we're doing through girlfriend culture, building what didn't exist for us so that the next generation of Black women never has to wonder if healing and rest belong to them. We center community-based healing, connecting Black women with each other. For those of you who don't know, the Black community is so spread out here in Arizona. So the biggest complaint with Black women that we see was that loss of community and that loss of like the third space too. And as people who come from a more communal healing tradition, it was important to build a community of Black women where they could just be and find sanctuary in each other. Like we said, they don't have to introduce themselves by their titles or talk about their accomplishments. They're free to just be themselves, talk about what they're reading. They can check their masks and capes at the door and be vulnerable with one another. And we fall back on the healing traditions of movement and storytelling, connection with nature, song, stillness, and full rest, as you see in these pictures. These aren't stock images. This is girlfriend culture. These are events. After the election, we saw Black women retreat for a much needed rest break. And while people saw this as Black women giving up, it was actually Black women operating under the principle of rest being our birthright, famously coined by Tricia Hersey in her book, Rest is Resistance. Rest, like the kind we center in girlfriend culture, is about dreaming. And we know a dreaming Black woman is a powerful force because we dream up thousands of liberation scenarios that topple oppressive systems. And all we need to do that is a pillow, a blanket, a soft spot to lay our head, and to be held by sisters. But as magical as girlfriend culture is, we know Black women still overwhelmingly want and need competent and safe healthcare services. They deserve care that treats the whole person, mind, body, and spirit with dignity and depth. While we are one avenue, we can't be the hospital that offers healthcare screenings, that can treat their burns, as Lia said, and catch their cancer or treat their hypertension or diabetes or deliver their babies so that both mom and baby are safe. We can't be their emergency room in their time of need. And while we can wrap them in sisterhood and call in their ancestors during movement practices, we cannot provide wraparound services to support them through a mental health crisis or provide them with refills on their psych meds. And those are just the realities. We dream of a healthcare system that listens when we say we're in pain, one that doesn't dismiss us, gaslight us, or make us prove we're worthy of care. We dream of doctors who follow up with labs, screenings, and real referrals, of birthing spaces where Black people, Black pregnant people, and their babies live, where our perinatal mental health needs are taken seriously, and our birthing plans honor both our physical and current health. We dream of clinics that don't shame our food or our bodies, where lose weight isn't the only solution, and providers understand that food access, housing, and trauma shape our health, not just defaulting to calories in and calories out. We dream of walking into facilities that feel like sanctuaries, bright, clean, peaceful, where we can see our doctor, therapist, and nutritionist, and maybe pick up our medications and go home knowing our care is connected. These aren't impossible dreams, and I do think Proposition 409 is kind of the start of some of those dreams with expanding healthcare services. It makes it more tangible that we can have women who have more options for therapists and more community health centers, increasing hospital capacity and modernizing spaces of care. It won't do everything girlfriend culture does because we're cool for the spirit, but it helped build the infrastructure for the kind of care Black women deserve. Care that listens, believes, and heals the whole body. And Prop 409 is how we move from dreaming about justice-centered healthcare to finally building it. Now, how you can help girlfriend culture. Definitely, we are accepting donations, and I do have the QR code centered here. You can also volunteer at one of our events, and you can feel free to reach out to me if you have any specific questions. And if you are a Black woman or know a Black woman or femme who wants to attend our events, please attend. We actually have an event coming up November 15th in conjunction with the Lit Twist. And we'll be doing an audio book walk in Steel Indian School Park. And we have some other exciting things coming up. Thank you so much for allowing me to share.
No, thank you. And thanks to Dawn, because Dawn kind of put this whole thing together when we reached out to her. And I think that you talking about the work that you do and referring to what this could do is really important. I just wanted to say that this Trump term, I mean, I think I was already kind of activated, right? But this time people are even more activated than before, right? But like the first term, a bunch of people were like, okay, I can't do this. Then 2020 hit, they're like, everything's fine. Now they're freaking out again. But one thing that I've been doing this time is showing up for racial justice and Working Families Party for trainings, because so many of them are put on by people of color. And the whole purpose, especially of Surge, the showing up for racial justice folks, is that, hey, white folks, it is your turn. We have been doing this for long enough. So here you go. We're going to give you all the tools. And I think that's really powerful. One thing I wanted to ask you, and this could maybe go to all of you, we don't have too much time, but I just heard something on NPR today about LGBTQ youth. Now, there's like some kind of study or survey done very recently that shows that our LGBTQ youth are in turmoil right now, worse than they have been in years past. And so I wonder if you all are seeing an uptick there too, as far as, folks reaching out, because I mean, even the 988 number, they removed any, reference to LGBTQ youth and them getting help. Are you seeing an uptick in your practice of LGBTQ youth trying to access services?
Yes, I should say referrals are up all around, but especially people from like with marginalized identities, they are coming into therapy because they feel actively threatened and targeted by this administration, right? And that does include our LGBTQ youth and adults, I should say, as well, who are having a hard time finding sanctuary, finding safe spaces within the community. Sometimes their families are, repeating like Charlie Kirk talking points at the dinner table, right? And the holiday season is coming up. And so that's a really difficult time for people to, sit with their families who they may not agree with and be on the receiving end of some discrimination and bullying. But we are seeing that. I see that probably more on the university level right now because I'm not working with teens as much. But my colleagues who are working with teens are seeing that uptick. And also, the interesting dynamic of working with a teen who comes out to their therapist, but it's not safe to come out to their families. That's something a lot of therapists are seeing right now.
And and now in places like Peoria, where they've essentially made it so the certifications for the social workers there, they completely changed them to essentially box them out, and they've lost 66% of their social workers.
Mhm.
And I'm a firm believer exactly what you said is the reason why, because that board had a full-on mega takeover, and oftentimes those social workers are the affirming adult in their lives, and they want to remove that for those LGBTQ kids.
Yeah. Yeah, and school social workers already have a hard job, like they're already overloaded. And then to add one more thing that makes their job hard and difficult, like school social workers, people don't know, are more so crisis interventionist. And so if you have a child that you are working with who the crisis is bullying or not being able to come out, right? not feeling fully accepted for their identity, knowing what we know about suicide and LGBTQ youth, how are you able to effectively manage the crisis, especially if there's a concern about them being outed?
Yeah, I mean, we all know this here, but it does seem that the cruelty is the point, and in many of in much of this, and also, you know, to essentially turn all of our children into little obedient automatons, right? That can just be controlled because they mostly see their children as property and not as, you know, autonomous individuals. But I digress. So I'm preaching to the choir here. I just want to say thank you all so much for this really important discussion. I'll go ahead and say it for you all. Please vote yes on 409. This is a nonpartisan bill, or I mean, a ballot initiative. It doesn't care what letter comes after your name. It just cares that everybody, especially our most vulnerable citizens, are taken care of. So I just want to say thank you so much to Dawn, Lia, and Lindsay for joining us today. And thank you all so much. I hope that you have a really wonderful weekend.
Thank you so much.
Bye, everybody. Take care.